Hello everyone, you are watching this video because you probably took a doggy home that just had a cruciate surgery, whether it was a TTA or a TPLO. We just wanted to go over some quick things you'll be doing at home and watching and checking your dog's leg post-surgery. This is Kai and Janessa. They will be our models for this evening. The best position to work with your dog after a surgery will be to have them on their side with their surgery leg up. You will notice that the leg that had the surgery is fully shaved and the incision from the surgery is on the inside of the leg. You will also see external sutures there. That is why it is very important to have the cone on for full 14 days for right after surgery for the recovery period, so the dog doesn't lick at the incision and does not introduce infection in there. You will be checking the incision daily. You're watching for any kind of increased swelling, discharge, or redness at that incision. If you're noticing any of those, please call your veterinary clinic. When you take your dog home, there will be a 12-week recovery period, and we'll be sending you home with detailed instructions, but a video is nicer to do a quick overview of what you'll be doing. Right after the surgery, you will notice there's a lot of heat coming off of that knee where the surgery was done, and there will probably be a lot of swelling there. Don't be shocked if over the next couple of days that swelling will travel down the leg. If you notice a big bubble there and you poke at it and it's like jelly, then it is normal swelling with some fluid buildup, and massaging that area out will help that go away faster. If you notice that the swelling is hard, that is not normal, and give your veterinary clinic a call. Right after surgery, when you bring your dog home, you will start with massage first because there's a lot of heat to that area, so you don't want to introduce a heat pack just yet. So you will massage the area, the muscles. It will warm up the muscles for the following exercises, and it would also move some fluid around to help with the swelling to be processed by the body faster. After you have warmed up the leg for about 5-minute massage, we will move to the PROM exercises, which stands for passive range of motion. That means that you will be moving the joints on that leg in their natural form in a repetition of 10. You will start at the toes, and you will move the toes back and forth 10 times. Then you will move up to the next joint and move that up and down 10 times. And then you will do the accordion style. So Kai's being very good and very tolerant, but right after surgery, your dog may not let you do this well, and that is normal. What you should be looking for is that over time, whether it's days or weeks and months, is that your dog should be getting more and more comfortable with you moving those joints around and showing you more range of motion. One other exercise you can do is moving the leg straight forward towards the head and then straight back towards the tail, again to the comfort of the dog. The dog could vocalize if it's too much, or what the most obvious thing would be is they would start pulling back their leg if you're pushing them too much. So you don't have to pull the leg quite as far if they're not comfortable at the time. After everything is done, all the exercises and the massage, we want to cool the area off with an ice pack. So you can either use whatever you have in the freezer, a bag of peas or carrots, or if you already have an ice pack, that will work well as well. You do want to put something in between the cleanly shaved leg and the ice pack, so a nice tea towel will work. And you want to wrap it around the leg where we did the surgery, avoiding the actual incision. You will hold the ice pack there for about 10 to 15 minutes. And you know that it worked well if the skin feels cool to the touch. If it's very cold, then that's too much time on the ice pack. And that's your daily routine. A few days after the surgery, the knee will start feeling less hot because the swelling will have gone away, and you can introduce a heat pack as your primary thing to start with. The heat pack, again, will act as a warmer for the muscles to get them nice and warm and moving for the following exercises. We do want to remind you that those external sutures do need to be removed in 2 weeks. You are welcome to come back to our clinic and we can take those out and do a quick check over of the leg. If you have any further questions, give us a call at the clinic. Otherwise, the recovery time is 12 weeks, so that's how long you will have to keep your dog on a short leash so they don't run away from you. And we're hoping that you enjoy this video, and if you have any questions, give us a call.